February is National Heart Month, and we've discussed how diet and exercise can help prevent heart disease, but there are other areas that we need to focus on, the aorta, and that needs our attention. Joining me right now is Dr. Jesse Manunga, a vascular surgeon with the Minneapolis Heart Institute at Abbott Northwestern Hospital. And doctor, what is aortic disease all about? What really is it? I don't know too much.
Well, first of all, thank you for having us over. The aorta is the major blood vessel that carries blood away, takes blood away from the heart. You think of blood, when you see someone alive, life is really carried inside the blood vessel or inside the blood. And the aorta is the biggest blood vessel that essentially starts from the heart, go up to your brain, your arm, all the way down to carry life. So that, in a nutshell, is the aorta.
So it's obviously a major part of the heart. How do you treat something like aortic disease then?
Well, there are three types of aortic disease, if I can break it down in simple terms. The aorta can become aneurysmal, meaning that it becomes bigger, it dilates up so that the wall gets weaker. In some people who have high blood pressure, the aorta can rupture or dissect. It's called the dissection. You can also have blockage due to buildup of cholesterol plaque inside. So treatment of the aorta really varies. It can be open surgery, where you are opened up, depending on what part of the aorta is affected, or it could be endovascular repair, meaning you go through the groin or through the arm, getting into the blood vessels and try to deliver therapy that way, depending on what it is that the patient has.
If it's enlarging or there's signs of it, are there signs that you can tell before the surgery?
There really aren't that many signs that you really can tell before the aorta ruptures, and that's really the most difficult part of aortic aneurysm. A lot of patients are walking around with aneurysm today in the United States. It's estimated about 750,000 Americans have aortic aneurysm, yet they don't know it. We know that 15,000 Americans die every year of aortic aneurysm. Of those, that died because the aneurysm ruptured and they didn't even know, and they didn't come to the doctors before knowing it.
Okay. Wow. And one thing too, what should someone do if they are at risk for this disease?
Right. So the people at most risk are usually male, more so than female. People have a history of aneurysm in their family, especially if they're first-degree relatives. So your brother, your sister had an aneurysm. You are 12 times more higher risk of having an aneurysm than me, who has never had an aneurysm before. People have smoked more than 100 cigarettes in their lifetime. Older people age greater than 65. Those people should have an ultrasound down of the abdomen to look if they have any aneurysm inside.
Okay, so the ultrasound is kind of a way to look inside a little bit.
That's right.
Okay, well, thank you very much, Dr. Manunga. For more information on our aortic disease, head over to KARE11.com, click on the shows and the 4 p.m. news. We'll be right back.